The meeting for Health and Human Services tonight. Can I have roll call, please?
Kay Wilson.
Here.
Tweed Schuman. Marshall Savitsky.
Here.
Chuck Van Etten.
Here.
Jeff Haney.
Here.
Bill Trepanier. Don Pettit. Carol Pearson. Sabrina Dunlap. You have a quorum.
Let's pledge of allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And certification of open meeting law.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Agenda has been set. Yes, Julia?
I do have one change on the agenda.
Okay,
On item 9, administration E, we'll be moving the budget review to next month.
thank you. Any other changes, additions? All right. Public comment. I have one. Holly?
Thank you. My name is Holly, and I'm a teacher here in Hayward. I teach 3rd grade at the intermediate school. And I also work part-time for a nonprofit group called Family Connect based out of central Wisconsin. And I met Chief Savitsky last week, and he suggested I come and share it with everyone. So I wasn't quick enough to get on the agenda, but I wanted to just kind of give you a brief overview about what we do. We are working to bring Care Portal to the state of Wisconsin, and it's being rolled out in a county-wide basis. It's currently being used in 34 states, so it's not really new. It's just new to Wisconsin. But basically what Care Portal is it is a platform that connects child-serving agencies with the community. So if you work in social services, you know there's not enough resources and there's not enough time to find those resources a lot of times. But we do know that our communities are full of people that really truly care about our children and want to help. And so Care Portal is a system that the county human services as an agency or the police department as law enforcement can subscribe to. And they are able to put the need into the Care Portal, takes just a few minutes, and then that need goes out directly to any groups in the community that have said, yes, we want to respond to these kinds of needs. Primarily it's churches, but there are also across the state, there are some businesses that are getting on board that want to help fund some of these needs. But what it really does is it takes that acquisition piece off the plate of the agency worker. And so it also, the thing that I get excited about when I look at it from my teacher lens is that it's a way to connect people in the community that want to help with the families that really need it. And there's a lot of that in every community. It's not just Sawyer County. So it's a pretty unique system. If you want to think about it like Airbnb in the commerce world, it's kind of like that in the social services field. We've got about 4 counties on board in Wisconsin just this year. We've just been working on it this year. I've been working actively in Douglas County this summer, and there's been a really strong response there. When I was talking with Chief Savitsky, he was saying, we come across things all the time, you know. Did I get that right or did I say your name wrong? Okay, I'm sorry. So yeah, it's just, I'm really excited about it. Everybody that I've talked to on both sides, the church side is excited because they want to help, but they don't know what the needs are. And agencies are getting excited about it because there's not enough time or money to help a lot of these families. The return on investment has been really significant across the country. We're seeing about a $7 return for every dollar spent. And that's a pretty huge ROI when you think about keeping children out of foster care, or supporting foster families, supporting kinship placements. And then the idea too is not only are we connecting these needy families with stable people in the community, potentially, if they choose to have that relationship, we're also making the need for foster placement more evident. I think sometimes just bringing awareness to a problem can help solve it. And I'm sure you don't have enough foster families.
Correct.
Correct. Nobody does.
Mhm.
So just wanted to kind of put that out there. If there's some interest in it, I'd be willing to set up a meeting. I've got some information if anybody would like to take with them. Okay.
Can you tell me how someone would access this program?
Yeah, so it's not open to the families. This is all the requests that are put into this system are from a child serving professional. So it would be from a caseworker, police officer. The Pregnancy Resource Center in town is on board and we are meeting some of their needs already. So Jerry Berg can put in a need. She's got some kinship placements that families that she's working with. They needed a car seat, they needed cribs. The need went out and within a few days, we had all of those items supplied for her. So it's not a GoFundMe, it's not a Christmas wish list. And that's what the support groups are really liking about it, is that they know these needs are vetted. They are significant needs that children need to have. It's not frivolous. You know, they're not asking for iPads. It's car seats and cribs. It can also be to help the family. As long as there's a child involved in the family, maybe a family needs some furniture. They're just getting set up in their own home, perhaps. It could be something like that as well.
Thank you.
Yes, thank you. Appreciate the time.
Any other questions for Holly? All right. Can I consider approval of the minutes from our previous meeting on 7/9?
I'll make that motion.
A motion's been made and seconded. Any discussion? All in favor? Opposed? So carried. Committee reports. LCO. Senior Resource Center.
Did you want to report, Marshall? Or? Sure.
We met last month and they're still looking for 2 open positions as cooks in the Hayward location, the Stone Lake location. They had some fundraising coming up here at the Red Schoolhouse Wines on August 28th and September 4th. Also, they are starting Monday night bingo at Riverside Lanes, starting the Monday after Labor Day to the Monday right before Memorial Day. So that's new for them. Upcoming cookouts and events, July 5th and 6th, that's already happened. Thank you, Linz. Looks like they raised over $2,000 on that day. Fundraising cookout in Stone Lake at the Senior Resource Center on July 9th. Looks like they made $400 on donations, and then they have a pie and ice cream social, which I believe already happened, correct, Lynn? At the McCormick House. They raised $500, I see now, the more I read. And senior fishing programs with Frank Pratt is coming up here on August 9th at the Senior Center, and where they're going to be making lures and other such fun activities related to fishing. They also got their farmer market vouchers out, which have been distributed. There are still coupons available, which are accessible to all the different locations for the farmers markets in the county. There are 5 in a coupon book at $9. And the Senior Resource Center budget has been submitted to Sawyer County with the same request as 2024, where they're asking for $150,000. That's all I got.
And I'm going to add just one quickly, that we received a very nice donation this past week. So hopefully that'll be on the next month's report.
Thank you for that, Marshall. Administration. Services.
Okay, the standard services list is in there. That has typically been in there. I lost, moving on to B, I lost my acronym glossary, so now I gotta go back and redo it. So we'll make sure we get that there for you. There's nothing worth discussing than not pushing save. So that is that piece. For admin update, I think some of the key things, that we have going on is really kind of looking fiscally at where we're at and how we're billing and looking at, ways to find, cleaner methods and quicker methods to get the billing out. Carrie's had a quick win for us in being able to electronically bill Medicaid, and has saved quite a bit of redundancy in the process. So working through that, and we've been working with Northland Counseling on billing as well. They moved to a new EMR, and we have some of our billing that has been kind of stuck in there. And so they've been working through that process, and I think we're getting in a good place to be able to get that billing out and into our revenue stream. I think those are really some of the key things where everybody's just been looking at ways to be able to do things better and get things forward. Moving on to the all staff meeting request. Last year, we had talked about having a few all staff meetings set up, and we have our next date potential available, and would be looking for approval to be closed either on November 12th or November 20th. One of those 2 days based on the number of staff that would be able to attend our all staff meeting. We would be closing at 11 a.m. on that particular day for all staff training. So I would need to be able to have an action move forward on that.
Do you have a preference of days? Dates?
Our preference is going to be the 20th, but the 12th would be our backup dates. So if we can do a motion to be closed on either one of those days at 11 a.m.
Anyone like to make a motion on that?
I'll make a motion.
I'll make a motion that we close on the 22nd
20th or the 12th.
or the 12th. I mean, that's what decided.
Mhm.
Awesome.
Did you get?
I think Jeff.
That's,
All right, a motion's been made and seconded to approve an all-staff meeting for November 20th or the 12th to close at 11 a.m. for the all-staff. Any discussion? All in favor? Opposed? So carried. And adult long-term care.
I don't think we have Carol on for the long-term care report. She had quite a few things in there today. I'm just going to highlight a couple of things. So on page 12, there is an impact report for the ADRC and tribal programs in Wisconsin. Hopefully you had a chance to process through that. Oh, I'm on page 12 of the
Oh, that's,
12 of the whole packet.
so I don't know what page that is.
Oh, it doesn't show up there. Okay, well, let's see, I can reference. So of that packet, let's go to page 3. Just gonna highlight just a couple of areas, and hopefully then you'll also have had a chance to look through. So page 3 is the map page. And Yeah, so this report really gives a really good overview of how the ADRC works and the services that are offered. One thing that I wanted to just make note, you can see that we are part of a consortium when you look at the map. So it's Bayfield, Ashland, Iron, Price, and Sawyer. And I think we've talked about that before, but just kind of highlighting. And then you can see how some of the other ADRCs also function. And then we also do have the LCO ADRC as well, that is specific to the tribe. As we move into the map on page 5, I just wanted to highlight those two maps. When you look at the contacts per population and the customers as a percentage of total population, you can definitely see that we rank real high up in this northern area as far as contacts and users of the ADRC resources. So when we hear our staff saying that they have quite a bit of traffic in there, we can see that is significant compared to other areas of the state. When you think about our population as well, it makes sense as we do have an aging population up here. And then the other thing just to highlight, the one thing that I have noticed with the program, so if we go to page 15. One of the things I've noticed with the programs is there definitely is modernization that's needed. The way they're, how they're putting their data into the portals, how they're able to pull up information, the amount of time it takes them to do documentation. It's a pretty old system that takes a lot of time to navigate. So they are looking at implementing a new system. Hopefully that will go well. And also one of the things that we're hoping that we get a better system on is also our phones to be able to track the amount of calls that are coming in, the times that they take, the times that we need to have staff available on those calls. It's really hard to tell from the system that we have, unlike the Income Maintenance Consortium, that is really easy to be able to tell what's all going on and where things are at. And it's easier for us leaders to make better decisions. So that's one of the things that they're pushing for on that level. So I know funding is being set aside in that area from the state level. And then finally, as we move beyond that report, June 15th was World Elder Abuse Awareness Day. And you can see that we had the pinwheels out there to represent all of the reports that did come in 2024. 2023, we are in 2024. I better get my years straight. So just wanted to highlight some of those pieces. Are there any questions? Okay.
So we'd move on to behavioral health.
Okay, so behavioral health report is there. Alicia, do you have anything you want to add? You have to go up to the mic to add your conversation. Or I can talk a little bit about a couple things too. Go ahead. Okay.
It's been, there you go. It's been really, really busy. Our CST program, I'll start there. We had our 6-month review due at the same time we had to have our new grant for 2025 due, all within a matter of 4 days apart. We were supposed to have our 2024 review on whatever date is listed on there. I don't remember. And the state lead called an hour and a half and canceled on us and didn't give us a reason. So we prepared for about 6 weeks for that and then they just canceled. And they haven't set up the new review yet. So that was a bit disappointing because you go through all that work and then, now if we were to do that to them, I can't imagine what would happen. So we did today, we got our
narrative done for the 2025 CST grant. It's non-competitive, so we will get it. It's just a matter of getting everything together, and then fiscal portion should get done tomorrow, and that'll be sent off. So we finally got that completed, and we will, this year, we're going to work with Youth Justice to try and increase some of our numbers. And actually with our CST program, 10 may not sound like a lot of clients on that, but we are one of the highest, the counties with one of the highest numbers in the state of Wisconsin. So I feel pretty good about that. So we're doing well with CST. And like I said, we're going to coordinate with Sarah from Youth Justice and try and help if we get that diversionary grant.
Mhm.
So we're keeping our fingers crossed on that. CLTS, that is an ever-growing program. It does not stop. I projected we would be at 60 by the end of September, and it looks like we will have 60 clients by the end of August. We have 2 case managers in that department, so that's 30 clients apiece, which is too much. They can't keep up now. And we are changing a lot of things with the way the record keeping is. And we're kind of in the same spot, like what Julie was talking about with ADRC and APS. We have outdated systems for billing. We have outdated systems for record keeping or note keeping, whatever you want to call it, progress notes, things like that. There's a lot of things that are changing. It seems like we have a new rule we have to follow each week. Our manual keeps getting bigger. We have weekly meetings, and they took our state county meetings away. So myself and Taylor from Taylor County, we developed our own regional meeting. And we started out with only 4 counties, and now we have like 23 counties attending. That was at the last one we had a month and a half ago. Because the state does not give the best guidance when you need it. Their fallback answer is the rule remains silent, which means figure it out for yourself. So having this meeting with all of these other counties, it gives us an opportunity to bounce ideas and problems off of other agencies and other supervisors, other workers, and figure problems out that we can get answers from the state from. So between CST and CLTS this last month, that's pretty much taken up the majority of everyone's time. CCS, we don't have that many referrals anymore. There's just too much paperwork. Providers don't want to do it. I just had one of our long-term providers tell me a week ago that she was not, take her name off the provider list. And she was one of the best that we had in the last 6 years. She was very consistent, but she does not want to do it anymore. Both the 2 counselors from Northland Counseling, they were CCS certified. So we have them, but they're so busy over there getting everything up and running, and everything is new to them. So I'm focusing on other areas where we've got more people coming in and trying to clean things up with Julia Carey for billing, note taking, things like that. So we really need to hire another person in CLTS. We really need to take a look at that.
And as we move forward in that, that is a program that really pays for itself. So being able to add another person should be that fund neutral as we move forward. So we'll validate that and get that forward.
Is your reporting program that you have, is that a state program that
Mm-mm.
you feel is inadequate, or is that a county program that you're using?
County Nightingale notes.
Yeah, it's an older EMR or EHR, medical record,
Yeah.
basic electronic medical record.
So is that something that you're working on changing?
We're investigating all of the opportunities with that right now, bringing Carrie on board. She's really helping to go through some of that. She has experience with lots of other electronic health records, looking at, are there updates we have missed along the way? Are there things that it can do for us that we don't realize it can do? Or is it just something that we're gonna need to be thinking about another program? I know many of the counties have moved away from that and into other programs, so just trying to find something that would work across all of the areas. I don't know that it would be it won't be ready to be implemented with the 25 budget, but as we move forward and thinking about 26, are there grants available? Do we need to update, and what would that be?
Thank you.
Mhm. Okay. Mental health expense report. Things are looking pretty good in that area. And it is pretty much status quo from what we have been seeing. We do have the crisis contacts report, and Joe might want to talk a little bit about crisis.
You see the crisis numbers from the second quarter, first and second quarter there. I'd just like to draw your attention to the fact that it stays pretty consistent, at least it has been. The first quarter of the year, we had 31 crisis contacts. The second quarter, we've had 30. And regarding the disposition of those, you can see that there were 7 adults hospitalized in the first quarter and 7 hospitalized in the second quarter. Children, there were 3 hospitalized on the first quarter and 4 in the second. So, you know, even though there's kind of a flow to the whole thing, I think the important thing is that we are reducing hospitalizations, and we are coming up with diversionary plans. Mobile crisis is involved, and that's through Northland Counseling, as Julia has said. And with mobile crisis, we had 18 mobile crisis in the first year, dealing with the first quarter with 31 of those clients. And we had 20 mobile crisis the second quarter for 30 of those clients. The remaining clients, I handle that or dispose of that either through conversations with an officer or make a determination that you know, there is no reason to proceed further. As I'm sure Jeff and Marshall can say, oftentimes officers call when they are wondering about things. You know, they want a CYA, and that's basically find out, you know, if this is something that requires something further. So that's where I kind of work on those. It's good that we've been able to remain consistent with these numbers, I think, and that's why the cost placement costs are down, and that should transfer into less transportation costs, you know, which is a good thing. I just mentioned to Julia today that you know, I'm pretty. So I guess I'm feeling good with the fact that Northland has been able to continue. It was 1 year ago yesterday that Carol Lund passed away. And these folks that work at Northland, they worked really hard to keep the program going. They are our main contracted provider for our mobile crisis, for our CSP, for all the chronically mentally ill, difficult people to manage in this county, which is upwards of 50 plus, you know, now. So, I mean, that's a good thing. They've been troopers and they've hung right in there with it. And a big shout out should be going to them. My only concern that I have, you know, in the twilight of my career here, is that somebody start looking at identifying how to treat the elderly population. As you indicated, we have an aging population here, and we have the problems I've had is trying to coordinate Chapter 55, which are the emergency protective placements, you know, as opposed to Chapter 51, the emergency mental health placements. And if you Google Helen EF, just Google Helen EF, initials EF, you'll find out that in the state of Wisconsin, the ruling is You're not supposed to detain people on chapter 51 emergency detentions if they have an infirmity of aging. So if somebody presents, as we had just last week, to the emergency room that have dementia, and it's even documented in their files and this and that, you know, everybody turns to think we got to put them on a 51. We have to put them on a mental health hold. An infirmity of aging is different than a mental health hold. And it also says in chapter 55 that the county is to have a designated facility to hold those emergency placements. So somebody's got to start working on this stuff. And that's just my concern, because we have an elderly population, and you know how it is. They end up in the hospital, and they're confused, and they shouldn't be put on a hold and drug into Winnebago and put there with chronically mentally ill, explosive people. It's just too disrespectful, and not alone, it's inappropriate. So I'm hoping that we can get some conversations going about that with the people that need to know that, you know. Okay. Any questions?
Is that a facility like the hospital that other counties have?
If you look
or-
at the stat, you know, chapter 55, they can be detained in in a nursing home. They can be detained like Clark County healthcare facility. They're not really supposed to be detained in a treatment center because it's not a treatable illness. It's a progressive infirmity, you know? And
Yep. Our situation is that those, just as we kind of lack emergency hospitalization and we're driving all the way down to Winnebago, the same thing is for this population too. Well, how do we manage that a little bit better? So
yeah, we need some
really
work on that.
difficult.
But there is going to be a meeting. I don't know if you're going to have one of the officers or yourself attend. Carol set something up with the governor's wife is
Oh,
hosting
that's
some
right. Thanks.
commission open forum on aging and treatment of the elderly with the healthcare system and this and that. So
Mhm.
we're going to attend virtually. I know the county might have somebody there. I'll make sure you get an invite and we'll have it over at the ADRC there.
Mhm.
Okay, but it's a real issue across the state. We should get on board. Thank you.
Thanks, Joe.
Joe, the crisis contacts, are those unique contacts, or is it potentially somebody in January is also somebody in June?
Oh, you want to, if they're like duplicated clients?
Yeah, are they?
Actually, there may be, and I can start tracking that if you want, but I'll bet you there's maybe 4 people most that have
Yeah.
come through again.
Yeah, that's a good question though. Yeah.
Hopefully, when we get the process going and they go in the hospital and we get a referral and they come back out and we get them into some counseling and this, we avoid that, you know. Thank you.
Mental health care resolution. Andy?
Sure, and Joe, if you want to jump in any of this, I'm not going to go through it in detail. I think you know all this, but WCA, our counties association, mental health has always been, or not always, but really the last few years has been one of the legislative priorities. So they're already starting to prepare for the 2025 budget process and putting their ask out there to the legislature to increase funding for community programs in crisis. So there's a white paper in here that essentially outlines the shortfalls of how counties are getting the federal reimbursement, but have to put in county money because the state's not covering their portion of it. And I believe the ask is for 21 million, which would I think cover about half of the unfunded cost of community support programs, and then also funding for crisis. So actually on number 12, number 1 and number 3 go together. So number 1 is the white paper that outlines the current funding and the shortfalls. And then number 3 is a resolution that they're asking counties to pass that goes into their legislative priorities to communicate to the legislature that this is an important need for counties. And I think Sawyer County has good history and experience here. I think, like Joe's pointed out, it's done a good job of getting like hospitalization costs or placement costs down, but it's still a significant portion of our levy. We have a higher number of cases in this area than a lot of counties do. So we're chipping in a lot of county levy money where the state could be funding that cost. So you have any questions, I can tackle them, or potentially Joe could, but really it's just looking for a motion to send this resolution to the county board so it can be adopted and sent to WCA and join in with our other counties and asking the state to fund a higher portion of the cost than they currently are. And that's, like I said, it's covering the full non-federal share of MACSP and crisis services.
I'd make the motion to send to the full county board.
I'll second that.
A motion's been made and seconded. Any discussion? All in favor? Opposed? So carried. So we'll send this to the county board
Yep.
for the next
Week's meeting.
week's meeting.
Mhm.
Thank you.
And I believe anybody going to the county's conference in September, there'll be some discussion about it there, and it's part of the business meeting to become part of. It already is a part of the legislative platform, but specifically now, they'll, assuming it goes through the business meeting in September, it'll be part of the formal ask to the legislature for the next budget process. To
How
increase
many
that.
other counties have a resolution like this?
I don't know how many counties are gonna pass the resolution, but in the white paper, there's 65 counties that have CSP programs out of 72. And they're all, as far as not getting the full reimbursement from the state, all 65 are in the same boat. We're probably in our own boat with a couple other counties because we have a fairly large caseload relative to the size of our population that's being supported by the levy. So it's a bigger chunk of our levy percentage wise than other counties because of that shortfall in reimbursement.
What is that percent?
In comparison to other counties
Oh,
or for our
For our levy.
we can talk about that next
Yeah, we can figure
month.
that out.
Well, I was just,
Yeah.
I mean, I was just curious.
Mhm.
I mean, yeah, yeah, at least. I mean, if you look at a similar sized county, I don't wanna,
Yeah, I
I can
don't
verify
know.
this, but I would say our levy is double similar sized
Yeah.
counties for human services. It's kind of squats on our overall budget relative to, if you took all the counties of
Mhm.
19,000 population, we have a much larger percentage of our levy going to placement costs. Because we have 38, 40 cases, CSP,
Oh, we're higher now.
higher?
Yeah.
We just have added like 3 or 4 new people.
Okay,
Mhm.
Generally, we're about 50 to 55. I also think you're a little lower than closest.
Yeah,
And
67.
now I think we're at 50 at least, you know.
Mhm.
okay, and if I would guess then other similar sized counties,
Mhm.
half that, less than half that?
Yeah.
Yes,
Yeah.
probably 6 or 8.
So I'd say 10,
Yeah,
yeah,
yeah.
yeah.
You know, a lot of it is relative to the fact that, you know, people come here, I mean, not that, when you have a hospital, the people from different catchment areas come to that hospital. We have a lot of crisis that comes from down south of the county line that comes to Hayward Hospital or, from over by Minot, and we have a lot of people that they just have moved here. The CSP clients, I think we have 2 that are from out of county. They were just in a neighboring county, but they came here and I get stuff like even people from as far away as from by I don't know, down by the city, right where the Wisconsin borders, Minnesota.
Mhm.
They look for housing and they fill out an application and guess where there's open housing once you qualify. Here, so people come up here, Can't stop that, but it's part of what happens. But our numbers are high and it's always a solid 500,000, I think.
Mhm. And one other thing, just to note on these resolutions, it has made a difference in other areas when I cannot remember what they were on getting funded. Maybe you can remember, but it makes a significant difference when all the counties pull together and say, yes, this is an issue. Legislatures, you need to be thinking about it. So that's where WCA has found the success before and is getting these resolutions ready for us to move forward.
The other resolution on here, number 2, put on here kind of just for discussion. This has been circulated amongst other counties in northwest Wisconsin. I think in part, Joe already touched on it a little bit specific to the elderly, but Polk County passed this resolution and has opened up a dialogue with neighboring counties or the others that in part, this came about because of the closing of the hospitals in Eau Claire, which provided some beds. But now our only options are much further away of going to Wausau or more likely Winnebago in the Oshkosh area. So they are advocating for establishment of a inpatient behavioral health facility in northern Wisconsin, somewhere that would be closer. I mean, the cost of placement is already considerable, and now we have to haul people 3 miles, 6 miles round trip. We hire an outside contractor that's a couple $1,000s of transport costs for every individual. So it's a considerable expense. So I brought this on here so you're aware of it. If you want to discuss this further or pass a similar resolution, we can put that together. I think we're already engaged though. I mean, I think our human services staff know these issues and are communicating with other counties.
Mhm.
We've talked about the transport cost specifically, and I know when my administrative colleagues have discussed trying to get this onto the WCA list of priorities. So it's not just about funding it, but it's about getting a facility in this part of the state for mental health or behavioral health stays.
So are we prepared to pass a resolution on a facility?
I didn't put one together. I mean, I would say if you want to make a motion directing us to do that, you can do that, or if you just want to pass the motion being supportive of this resolution, we can put that into our plan of work. So like, there's already some discussions coming up on, what was that forum that's coming up?
That one's for the elderly, though it won't be for this one.
Okay.
Crisis stabilization facilities, if you read on it, they don't say Sawyer. They list counties and Sawyer's not in there. West is in there on this one here with Polk County on it. They don't list Sawyer, they don't list Ashland, they don't list Haven. So I don't understand why we're not listed on any of those.
I don't,
Yeah, where is it?
where does it say the other counties?
And some of the papers say that establishing facility, these facilities, 2 of them within the state crisis stabilization.
Yep.
Used in these areas and they name these counties, but
They might have been writing their own resolutions, I'm guessing. No, I mean, that's not this resolution.
And I looked into it,
Yeah,
and I was wondering if maybe they thought we had one funded up here, but that's how the state looks. They look at, Ashland's got one, which they did fund, or at least try to fund with North,
mhm.
they threw the one up there.
No, and I can tell you from the directors that we're in the region with, there's quite a few that are on the eastern side, so the northern, northeastern area. And, you know, now we have patients that are going over there, so they really would like to see something more in our area as well, because we're taking up their beds that they will potentially are needing as well, so hopefully.
County doesn't have an issue. They go, they're a border facility,
Mhm.
you know. So-
Yep, and we can't, yep.
Well, I think we should move forward on a resolution like the Polk County resolution for inpatient behavioral health facility.
I would just make a motion, we'll bring it back next month. If you want.
I'll make a motion that we bring that back next month for review and possible action.
I'll second that.
Motion's been made and seconded. Any further discussion? All in favor?
Aye.
Opposed? So carried.
Thanks.
Okay, Child Protective Services and Youth Justice.
Okay, I think I've got Sarah on. Are you able to unmute? I don't know if you have any additional things to report out on tonight, Sarah?
No, I don't have anything additional tonight.
Do you have any questions for Sarah? I think the only additional thing I would have to add to that is Sarah and Carrie have been working very diligently on applying for 2 grants for diversion program. And thank you to everybody who put in those referrals or those letters of support. And we will be finding out, I believe, in the next couple of months, whether we get funded for those programs.
Excellent.
And the other thing that we have is just the standard children in care expense report. Nothing really outstanding as far as our CPS caseload.
Okay, let's move on to economic support.
I've submitted the unit monthly report. I'm not going to go through those, case by case here, but if you have questions, I can answer them. Updates for our unit, MAP premiums, that's the Medicaid purchase plan. Those premiums went into effect again August 1st. The state did not do the best job in getting that information out to members. So that's created a lot of stress for my staff. They are working to get those issues resolved, but it's brought in more traffic into the agency with a lot of people concerned that their Medicaid will end if their premiums don't get posted. So these are the ongoing cases that now have premiums due for ongoing. They didn't get their coupons really in a timely manner. They got them at the end of July. The payments are due by August 10th. We don't post them here at the agency. We just mail them on to Madison. So there's been a lot of concern. In fact, I had a former employee come in who was an authorized rep today. And, she knows me, so I can tell her, this payment is getting sent down. They're going to go by the postmark date because we all know how slow the mail moves, but she knows me. So she trusts what I'm saying is true, where it's sometimes hard to convey that to other people. So there's been a lot of concern, an increase in phone calls in our call center regarding the MAP premium. Hopefully, within the next couple months, that gets smoothed out. So that's an update on that. And then food share interviews, those come back September 1st. So right now, if you call into our call center and you apply for food share, we do an interview, but you can apply through Access or you can apply through the mail-in application. And unless there's something questionable on that application, an interview has not been required. So that is something that, again, will slow down our response time in the call center, and we'll be receiving more calls as of September 1st because those interviews are back in place. And this is part of the COVID unwinding process that we've been going through over the last year. So good news is the vacancy in this department. We offered the position and got an acceptance. So we will have a new employee starting September 9th. So.
Yay.
Thank you.
Public health.
Good evening. I just wanted to highlight a couple of things from my report. Our Birth to 3 program did receive our determination status from DHS, and it was needs intervention. So we're looking at our data quality and completeness. We've implemented some internal processes and review of child outcome data as we move forward. And that was for the fiscal year 2022. So we just received that determination status in July. Our annual Birth to 3 family activity was last week on Tuesday. There was quite a significant rain shower during the activity. However, there was a lot of good feedback. And I believe we had 90 people attend, so it was a very well-attended event. I did want to highlight that August is National Breastfeeding Month, and as a part of that, we did have an event yesterday. We have a new lactation space, which was officially opened, and we also wanted to honor the legacy of Eileen Simak. Eileen worked for the county for 25 years, 9 of which were as health officer. We had her husband, Rich, and her daughter, Elizabeth, come and do the ribbon cutting for the official lactation room space. So we were grateful to have them. I did also want to mention that we are hosting a full-scale sheltering exercise on September 11th. I did include a link in your packet if you're interested in volunteering to act as a survivor of a disaster and in need of shelter. That event will take place at Hayward Wesleyan Church, and it is an all-day event. HHS staff and MRC volunteers will be prepping the shelter from beginning to end. So it's going to be a good full-scale exercise for us. The walk for tomorrow, and I do have some flyers, so I'll just pass those, which is our suicide prevention walk. That will be September 20th and 21st. The 20th will be in Hayward, and the 21st will be in the Winter area. So information is coming around on that. And I just wanted to give a quick update on the Tourist Rooming House Ad Hoc Committee. That committee did meet on July 31st. A motion was made to include language from the discussion of that meeting. So right now, HHS staff is compiling that to take back to the ad hoc committee later this month. Are there any questions? Okay, thank you.
Fiscal budget performance report. Is there anything that jumps out at you, Julia?
I have some things in C or D. I wanted to just check with Carrie to see if you had any additional comments that you wanted to make first.
No additional comments.
Okay, so I just wanted to point out where we're at, and it's again what we've been talking about each time, but on our on page 65, oh, actually on the purchase service, you're there. On the purchase service area under family services, we're definitely much lower on our spending on our RCCs. But we've made up for that in juvenile justice. So hopefully in the long run between the two will be okay, but we are taking that into clear consideration as we move into our next budget year, that really the secure detention centers are where we are seeing our funding go to. And I think we're going to see a fairly steady stream over the next 2 years on those numbers, just based on what we've been seeing. The other thing on the revenue recap, Transitions House, we are doing really well in bringing additional revenue in there. Part of that is our beds are being filled, and Joe has been working with other counties to fill the beds. And the other thing is that we have had the right type of clientele that are in there that we're able to use some grant funding to be able to help cover those expenses. So that's why we're seeing increase of revenue there. And I did mention earlier with the CSP medical assistance that we were behind, but we're working with Northland and to get that billing going so that we can see that return coming in. So those are the significant areas that I just wanted to recap on. Any questions? Okay. Okay, I think that covers us for fiscal.
Okay. Are there any outside committee updates that anyone would like to share? Any future agenda items that anyone would like to be placed on the agenda?
The new resolution.
The resolution, right? And we'll continue to have the tourist rooming house on there and
Mhm.
then the budget.
Mhm.
So with the budget, do we need a public hearing with that?
Yep. Oh,
meeting
yes.
as
On the
well?
budget, we'll be adding a public hearing again. I will also be having meet the director kind of time where people can come in and just talk with me regarding that before our next meeting. And we'll be sure that we get that posted more than 2 weeks ahead in the newspaper so that we have that done accurately.
Okay. Any correspondence or reports from conferences? All right, we're adjourned. Thank you, everyone.